Well, good morning everyone. I'm Vicki Sutton, I'm CEO of Melbourne City Mission. Thank you very much for, I can't do that, right? Stand here all day with my hand up like a shield. So look, really feel free, to come down and fill up some of these spaces down below if you like. When we get to the Q&A session, I've been told I have to point people out to send the runners to with the mic. So if you're at the back and you think you might like to ask a session, I reckon if you come down, I've got a better chance of spotting you just with the lights, the stage lights. So welcome today. We're going to be talking about providing meaningful responses when there is no housing. I'd like to kick off by acknowledging that we're meeting on the traditional country of the Kaurna people of the Adelaide Plains and pay my respects to elders past and present. I acknowledge the Aboriginal and Torres Strait Islander people's connection to land, sea and community, and respect their cultural, spiritual and educational practices. I'd also like to acknowledge the people with lived experience of homelessness who are at the conference. Your experiences play a vital role in shaping better outcomes for the future. Now, shortly I'm going to introduce my panel. We'll have some presentations and then we'll start a Q&A session together, and I'm going to invite you all to contribute to that. So as you're listening, think of any questions that you might like to ask panel members. And when we get to that part of the session, I'll invite you to raise your hand and we'll have a discussion. But first, I'd like to make a few comments. What a diabolical topic, hey? How to provide support when there is no housing. How to provide meaningful responses. But that really is a reality for so many of our services, including Melbourne City Mission's experience. And I want to share a little bit of that experience now. MCM is Victoria's homelessness provider. We operate the only youth-specific homelessness access point in Victoria. We triage throughout the youth refuge system, run a number of refuges and deliver other youth homelessness and accommodation programs. And we know we're holding young people in homelessness for far too long. Just last week, for Homelessness Week, we released our first ever snapshot of young people currently in our homelessness and housing services system. And we were able to collect some sobering data that paints a picture that everyone that works in our service knows to be true. And some of those stats are that 2/3 of young people have been experiencing homelessness for more than 2 years. Even more shamefully, 1/3 have been cycling through homelessness for more than 5 years. So when you think about people aged 15 to 24 to lose 2 years or 5 years bouncing around homelessness, worrying about survival, well, that's years of lost education, connections, community relationships, and the chance to gain employment experiences and opportunities. Frankly, it represents lost futures. And during that time, young people are spending stuck in homelessness, their mental health deteriorates, and our stats bore out that half of the young people in our service have thoughts of suicide, are actively attempting suicide or self-harming, and half are using emergency departments to help manage their mental health. And when one of our young people is admitted to hospital, 2 out of 3 are then discharged back into homelessness. Why are they stuck in homelessness? Well, there are definitely particular barriers experienced by young people accessing housing that are different to adults. They have lower incomes, including youth allowance, and that means their rental capacity is lowest of all possible tenants. So they're locked out not only of private rental, but also of social housing. And other barriers exist, including their lack of rental history, their perceived risk versus other groups of possible tenants. As a result, while young people make up 15% of everyone seeking help from a specialist homelessness service, they occupy less than 3% of social housing. And in Victoria, we've got a shortfall of 5,000 medium to long-term houses for young people, And that means that only a quarter of young people in our homelessness system will get a housing outcome at all. And that's not good enough. So while today we talk about how to meaningfully respond with that challenge of no housing, I do want to touch on our role as part of this flawed system to change the paradigm of no housing through advocating for what's required. And Home Time is a great example of this for youth homelessness. There is a stall there where 150 organisations nationally have come together to advocate to the federal government for 3 key elements that need to be addressed in youth homelessness. That's dedicated stock for young people, rental subsidies to address those financial barriers that I talked about because of their lower incomes, and support to help a young person, once they have housing, gain their education, employment, and build the skills necessary to become independent adults. So I do encourage you, while you're here at the conference, to visit the Home Time booth here at the conference, sign up and support this really important initiative. Now I'd like to introduce our panel. We have Tony Davies, CEO of Social Futures, not-for-profit, predominantly in regional New South Wales, dedicated to delivering essential support services in housing and homelessness, mental health and wellbeing, children, youth and family, disability inclusion and sector development. Tony has over 20 years of experience in leadership within government, NGO and private enterprise, and is a qualified lawyer. Don't hold that against him.
Can't believe you said that.
Tony's committed to achieving positive social change and creating equitable communities. He actively advocates for issues impacting regional Australia, including affordable housing, raising awareness, and promoting policies that prioritise critical need in regional areas, especially when access is limited. Tony is followed, or actually the order's changed, so Tameka Thompson will actually be coming up first. Tameka is Aspire Program Manager and Clinical Lead at Hutt Street Centre in Adelaide, right here in SA. Tameka has a social work degree and has worked at the centre for over 10 years in both management and leadership positions. The Aspire program started out as South Australia's first social impact bond and Australia's first homelessness-specific social impact bond. And due to the success of that bond, the program has evolved into a government-funded program. Tameka is passionate about the organisation's vision to end homelessness and aim to support people achieve homefulness, something I've only just learned a new word. And a fun fact that I am adding, Tameka and I both grew up in the same small country town in SA, and our parents know one another. Now, our third speaker was to be George Hatvani from Launch Housing. Unfortunately, George couldn't be here due to illness, so I am so grateful to Laura Mahoney, also from Launch Housing, for stepping in at short notice. Laura is the Executive Director, Homelessness Solutions and Impact. Launch is one of Victoria's largest providers of housing and homelessness services. Thank you so much, Laura, for coming today. So, can I invite our first presenter, Tameka?
Thanks so much, Vicki. I've also got the privilege of knowing your wonderful parents, so we've got a lot to catch up on later, I'm sure. So today I'm here to chat to you about the wonderful Aspire program that's delivered by the Hutt Street Centre. And to use Vicki's words, it is absolutely diabolical at the moment. Part of me had a bit of a moment this morning thinking, are we sitting here talking about this? But whilst it is really tricky and it is pretty dire across all of our states, I'm not here to tell us, how to suck eggs. It's nothing that we don't know, but there's hope, and, I know that we're all doing really, really good work and supporting people that need us the most. I'd just like to acknowledge that we're all here in what I believe is still sunny Adelaide this morning, and we're meeting on the Kaurna lands, and just want to pay my respects to elders past, present and emerging. The Aspire program started as a social impact bond focused on supporting people to end their experiences of homelessness. The program is delivered by the Hutt Street Centre in collaboration with the state government, Social Ventures Australia, alongside our housing and referring partners. The program aims to house people, I say as quickly as possible. As we know, and we've talked about a little bit today, and I'm sure we'll talk about across the next 2 days, housing first, whilst amazing and evidence-based, and we're all trying to strive to achieve it, it's not working exactly how we would like at this point in time. So I say housing as soon as possible to reduce the demand from people experiencing homelessness on hospitals, prisons, and emergency accommodation. This reduction in demand translates to cost savings for the state government. As of December 2023, there was a saving of $32.7 million over 6 years and counting. The Aspire program applies the 70 years of Hutt Street Centre's experience in assisting people in Adelaide to end their experiences of homelessness. This starts with the model of care, which will pop up on the screen behind me. Primary care is provided through our Wellbeing Centre, where we are able to meet people's immediate and basic needs like a nutritious meal, a hot shower, somewhere to charge your phone, pathways, groups and activities, and a huge variety of visiting services like nurses, doctors, Services Australia, financial counselling, and the list goes on. We have access to ID, we're a postal address, and it's really that first point of contact to sort of start linking in and connecting with everything that you really need in those early days of first experiencing homelessness or first sort of landing on Hutt Street's doorstep. Secondary care is the next step and is when a person is connected to short to medium term case management support through our Towards Home Alliance Resolve team and our Age City Living team. Tertiary care is where Aspire comes in, providing up to 3 years of comprehensive case management support. Tertiary care is the pathway to homefulness, working relentlessly with people at risk of or experiencing homelessness in order to fulfil their right to live somewhere peacefully, securely, and with dignity in a suitable home. It means having a place to live with a sense of security, stability, privacy, safety, and an ability to control the living space. Homefulness empowers independence and self-determination. In 2022, an independent evaluation of the Aspire program was completed, which found that the model worked and achieved its aim of supporting people to end their experience of homelessness. The current data tells us that Aspire has achieved higher than expected engagement rates at over 80%. We have housed over 80% of program participants and supported participants to maintain their tenancies with an 85.4% tenancy retention rate. Close to half of all participants were supported to attain community connections, education and employment outcomes. One question that continued to arise throughout the evaluation process and continues to arise even since then is how did the program keep participants engaged despite housing supply not meeting demand? The data and evaluation proved the effectiveness of the model, but how was the model so successful in the face of a lot of unpredictability since it began in 2017? We faced a global pandemic with COVID-19, the increasing cost of living, and national housing crisis. We're experiencing historically low rental vacancy rates of less than 2% nationwide, and Adelaide's vacancy rate in June 2024 being 1.13% and was the lowest in the country. In an attempt to explore and answer this question, Hutt Street Centre worked with the University of South Australia and a social work honours student, little shout out to Amy, who joins us in the audience, who's now one of our wonderful Aspire case navigators. And we focused on a research question of what factors help maintain participants' engagement and connection in homelessness services when housing is not immediately available. The research found a gap in literature about the importance of supportive relationships and maintaining engagement. There was some information available around the role of helping relationships and that the strength of this can impact success of case management. This research found that there was limited information on the effectiveness of the helping relationship in the homelessness sector specifically. The information that did exist focused on the child protection and family welfare workers' perspectives. The research found three key themes that arose as ways for services and workers to maintain engagement with participants when access to accommodation options are limited. These were meaningful support, characteristics of a worker, and supporting workers. There were 5 elements of meaningful support. Duration of support was the first. Aspire supports people for up to 3 years, which allows time to build positive working relationships and meaningful connections where participants can be honest and express their needs. Being participant-led. We focus on meeting participants where they're at, providing options and information for participants to make decisions that impact their life. Regular contact. Workers throughout the research process reported that keeping in contact, even when you don't have new information or a housing offer, strengthens the helping relationship. Keeping in touch to check in, seeing how things are going proved really worthwhile. Goal setting. This needs to be a collaboration between worker and the participant. The participant is the expert in their life and they are the only person who can identify their needs, and the worker can facilitate the process in achieving the goals. Provision of and connection with resources and services. Access to Hutt Street Centre's Wellbeing Centre was the key element in provision and connection with resources. Workers reported that they found meaning in having readily available resources within their own organisation. The centre provides a place for staff to meet and connect with participants. It can be an especially vital engagement tool when we're supporting people who don't have access to phones or don't have a safe place to meet. It is a means to connect with other supports relevant to goals, such as financial counselling, legal supports, and the allied health multidisciplinary team. The second theme found 4 key characteristics of a worker that play a valuable role in meaningful support. The first being relentlessness. Keep showing up and going the extra mile to maintain engagement, being there when people disengage and being there again when they re-engage. Showing care and persistence. When you show participants that you're not going to give up on them, it really shows them that you care. Transparency. Explaining the processes involved in accessing housing, being clear on what you can do, what the worker is doing, and why housing hasn't come to fruition yet. Bringing that person along with the journey, as much as it's not always happy and it's not always a fun conversation, it really demonstrates that it's a partnership. Flexibility and honesty. Willingness to meet participants where they are and communicating honestly. Being genuine and non-judgmental is key. Do what you say you're going to do. The third theme was supporting workers. Looking into how the workers in the homelessness sector maintain their own wellbeing to continue providing effective support in an environment where they have limited access to the resources required to address the needs of people experiencing homelessness. I don't think it ever gets easier to say to somebody, sorry, you don't have anywhere to sleep tonight. No, we still don't have housing for you. Yes, we've been trying for months. Yes, I've nominated you for all of these properties. Yes, we've got all of your documentation in. It's really, really tricky. And once again, I'm not saying anything that the people in the room don't already know. I don't think there's any sort of way to sugarcoat it and present it in a shiny, shiny way. However, there are ways that we've found through the research that help people maintain engaged and maintain hope and, that motivation, what gets us up in the morning, what gets us to work in the morning. Workers reported finding hope in knowing that the fact that the person was engaged with Aspire's support meant that they were closer to securing housing than they were when they started experiencing homelessness. It's better to be supported than going it alone. Workers reported feeling connected to the vision and mission of Hutt Street Centre and to the purpose of the Aspire program, and this was also identified as what was keeping people engaged. Prioritising training and formal supervision that is supportive allows time to work through caseloads and reflect on practice at all levels, an individual level, a leadership level, and at an organisational level. This ensures that workers have current best practice knowledge and skills and feel supported to utilise them to support their participants. Through this research, staff members reported that one of the main things that keep them engaged in their work is the supportive workplace culture. Working for an organisation that allows space to debrief on difficult experiences helps alleviate feelings of burnout. I think one of the things that we talk about quite a lot in the office is laughter, having someone to chat to. What are you doing on the weekend? What are you having for dinner tonight? You know, somebody when you come back from a difficult visit, or you've had a really tough phone call, or you're feeling really stuck that the housing just isn't there. There's always someone that can share that journey. There's that peer support. We're in this together. We can debrief with each other. We can brainstorm together. We can look at different strategies, share what's maybe worked with, you know, somebody else and one of their participants, share what's worked, you know, in advocating stronger or doing something differently. And I think that's something that even outside of the research, I know in our organisation we talk about it all the time, and it comes through in teams, it comes through in supervisions, and I just think that we need to place a lot of value on that. Despite housing being in high demand and short supply, the Aspire program has demonstrated support and achieved amazing outcomes through their relentless case management. The Aspire Social Impact Bond has completed its 7 years, and due to its success, the program continues as a state government-funded homelessness service. Being able to provide meaningful support to participants promotes staff wellbeing and keeps both participants and staff engaged. This doesn't negate the fact that we need housing. We don't know if or when the housing crisis will ease, but we continue to show up and work in partnership with people experiencing homelessness. Thank you.
Well done. Great presentation. Thank you.
Thanks, Tameka. That was really fantastic. And thank you for the tour of Hutt Street the other day.
You're welcome.
Okay, so I'm going to talk about a program in the Northern Rivers, which, you know, I have to say, some of what I'm going to talk about is remarkably similar to what Tameka's just spoken about. So we might work through some of that quickly and get to the questions. So the Tweed Assertive Outreach Program is in northern New South Wales, and it's an area, there was some discussion of climate change earlier today, and it's an area that's been quite affected by climate change, which necessarily has an impact on the work we do. But look, I'll also acknowledge that we're meeting on unceded Aboriginal land, and after the referendum last year, we all need to do more to ensure that we actually move towards a just future for all people in this country. And I think Artie Roslin was very generous in her welcome. I'd like to thank her for that. The artwork we display there is called The Ripple Effect. It's by a colleague of ours who, Dr. Ian Freeburn, who did that artwork for our organisation to symbolise the rivers that run through the land and the connection that we create. Okay, so the Tweed Assertive Outreach Program is a collaborative program. It's not just delivered by us, it's also another specialist homelessness service, Momentum Collective, and really importantly, Homes New South Wales and New South Wales Health. And I have to say the collaboration took a while to actually work out in the early stages, who was in charge, who did what, how we come to a collective model of decision making. And I might acknowledge some of the people involved in the program. We've got Karen and Jody there who work for us, and also Jason, who's worked for every major homelessness provider in Tweed, currently Byron Youth Service. And there was a lot of discussion on how to make it work. So the focus is just in the Tweed local government area and prioritising those who are most in need. We have specialist case workers, housing workers, and really importantly, access to health workforce, because that's a key part of actually how you get to a point where people can gain and maintain housing. The context that we operate within that program is it's a regional part of New South Wales on the far north coast, just south of the Queensland border. And we have really high housing cost. Housing cost in some areas like Byron local government area are at times have been higher than Sydney, and they're higher than pretty much every other capital city. And rental availability has, for much of the past 5 years, sat at below 1%. And despite it being a very high-cost area, the majority of people living in that area have very low income, and they've experienced a lot of pressure. And the climate crisis has had some impact on that, whether we have the fires in 2019, which the community still hasn't quite recovered from, major flooding in 2017, and catastrophic flooding back in 2022. So it is a community where there is community-wide trauma, and there is significant mental health and wellbeing concerns that we see across the area. And fundamentally, we have a very significant problem of people not being housed. The street counts statewide have indicated that over a third of the people who are counted as being unsheltered, and Jameen, I'm going to take that term and use it a lot more. It's not a perfect count. I can acknowledge there are different definitions, but we have a very significant proportion of the state's unsheltered population living in the Northern Rivers, despite having only about 4% of the state's population. And this year's street count indicated that we had significantly more people who are unsheltered in the street count living in the Northern Rivers than all of metropolitan Sydney. So I think it's going to be a theme at the conference that housing availability, how we get access to housing, is just going to be fundamental to how we move forward. And I'm glad actually there is some cause for momentum, and we should be thinking about how we move forward. So it's a really good theme for the conference. If you read on the website the evaluation of this program undertaken by ARTD consultants, there is a service model diagram that is breathtaking in its complexity. It's a beautiful program logic, it's great, but we've really broken it down to something that's relatively simple, that we start with the process where people who are seen to be essentially sleeping in public places are flagged, and then a patrol will go out and engage with those people. I've been lucky enough to go out on one of those patrols. As I was outed earlier, I'm a lawyer, so I have to always tread gently in this sector. And the way the workers from the various organisations, the degree of respect that they gave to everyone that they worked with, that they approached and encountered. And there were some very unwell people that we met with that morning. Is just astounding. And I think those personal characteristics that you spoke about, Tameka, are really key to how we do this. We then move to the stabilisation process. And fundamentally, we've had to rely on temporary accommodation. There's just no social housing readily available. That was the case before the natural disaster. Then, in the context of natural disaster, there were 15,000 homes that were damaged, 4,000 to 5,000 of those rendered unlivable. And then as we've been, as a community, looking at how we provide long-term housing for people, priority has necessarily included those who are flood affected in social housing. But that then has a flow and impact for those of us working in the homelessness space. The model provides for 12 months post-crisis case management support, and then a warm exit from the process. What we found, and I'll say this is the data that we have for the Social Futures participants, so there's a broader cohort of people that have been supported through this program. I think the most important thing is that generally it's been really effective at helping people sustain tenancy. And really, that is quite an amazing achievement when we're talking about people who have really fallen between systems and have been unable to engage with the system. So it's the current rate, I mean, the data is constantly changing, but we're well over 95%, so we think that is a really good outcome. The level of work we do each year, I guess, we're working with probably 76 people a year, and we've been able to house 20 people a year. So obviously that issue of housing that Tameka mentioned is always really difficult. The important thing though we've found is being able to re-engage. So yes, it's a 12-month support period, but if we have to, we will re-engage to ensure that people stay housed, and that's really key to maintaining the tenancy. Also, some really good wellbeing outcomes, and this goes to the fact that if you can't house people, it's how do you actually provide the level of support that enables people to actually have a positive view of their life and to feel optimism and a sense of hope. So how do you engage with people through social supports? So despite the fact that we can't always house people over the longer term, we do actually have some really good outcomes that we're seeing in terms of people's well-being. Okay, looks okay. Apologies for that, there's clearly something happened. Okay, so when we talk about what the success factors are, obviously it's that multidisciplinary approach and really strong relationships within the service system, knowing who is out there and what is required to meet the needs of that service provider and to enable the people we work for to actually access that. A bugbear for us is temporary accommodation, and I will come to that in a second. We absolutely have to have temporary accommodation because housing first or a rapid rehousing approach is just not possible. And temporary accommodation essentially is via motels, and it's via private motels. I think the other thing is being able to access the specialist supports when needed. So the NDIS, the National Disability Insurance Scheme, is really a key factor in being able to support people to access the NDIS so that they can get support with the activities of daily living, which in turn will assist people to maintain housing once they gain it. And as Tameka said, that timing and intensity of support, it's being there, it's showing up, it's following through, that's really critical. And what we find with this type of program, unlike your traditional specialist homelessness service, is having that ability to provide intense support really does get the results, which leaves us with that dilemma in homelessness policy. Do we try and work with everyone a little bit, or do we work with a small number of people a lot and try and actually get outcomes to move people through? So a couple of the issues that we see, one is the Queensland border. So when I grew up outside of the Northern Rivers, I believed the border was a river. The Tweed River, north of the Tweed was Queensland, and it's not. The Queensland border is a number of streets. And obviously, for the people that we work for, state borders don't mean a lot, but for government agencies, they mean everything. And we tend to find that the demand for our service is often influenced very strongly by the approach to regulation of public space in Queensland. And there have been times, or there are times, where, for example, people that are seen sleeping in cars will be moved on, and then ultimately it becomes up to us. They'll move across the border and our staff will be working with them. Housing availability, and that really important one of pet friendliness as well. There are so many people that you come across, and again, when I went out with the team, you know, they had a pet, and it was because they had 2 dogs. Getting access to share accommodation was a real issue for that particular couple. The temporary accommodation system, supported strength-based trauma-informed temporary accommodation, I think, can have real benefits for people when we don't have housing. The issue that we have in the Tweed is that temporary accommodation is provided by some for-profit providers who own motels who've been able to enrich themselves very, very well through the process, and they have, in all honesty, treated some of the people that we work for, people who deserve the utmost respect and dignity, absolutely appallingly. And so we really need, I think, from a policy level, look at how we can turn that round. Also, just the cost of getting specialist support. The complexity of the human service system, I'll come to that in a sec. Natural disaster preparation, I think we have to understand that we're in an age now where climate change will affect the weather quite significantly, and we need to be prepared better. The response in northern New South Wales to what was a disaster that we didn't think was going to come wasn't particularly good, and we need to ensure that we learn well from that crisis, because those that are sleeping in public spaces, those that are unsheltered, will be most affected by the natural disaster. And certainly in providing this response, one of the issues that we had was that in the early days of the response, there was a view that if you were homeless before the flood, we didn't need to provide housing for you because you weren't housed anyway. Now luckily, that attitude did shift quite quickly, but we need to be thinking about that as we go forward. The final thing I will leave you with is I learnt a new word from Dr. Gregory Smith, who will be talking tomorrow, the word infuriation. I thought he made it up, but if you Google it, it is actually a noun. But his definition is the feeling experienced by a person who's not housed when they are repeatedly bounced around between services. And I do think we talk a lot about trauma-informed practice, but I don't think we're really talking yet about trauma-informed service system design. The way our service systems operate, the way they interact, often meet the needs of the service providers more than the actual service users. They're designed with a logic that is logical perhaps to us as service providers, but if you're freezing cold and it's raining and you're struggling to get some help with your feelings of well-being or anxiety, the service system doesn't make sense, and that obviously escalates your feelings, and it also results in that sense of anger, hopelessness, and why should I bother engaging anyway? And I think even without resourcing, if we can really look at service system design, that in and of itself will help. Thank you.
Hi everyone. Thank you both for speaking so eloquently on a topic that is really, really difficult in some ways to think about. And I also recognise that I'm not George. Some of you have probably heard from George in various contexts before. However, I am really glad to be here actually to talk about this particular topic. I'd like to start though by acknowledging the traditional owners of the lands that we're on now, but also the lands that all of us work on. And to also recognise that our First Nations populations are disproportionately affected by homelessness, and therefore the topic that we are talking about now also disproportionately affects the First Nations communities that we're all working with. And so thinking differently about how we can provide services is a really important part of what we all do. So how can we provide a meaningful response when there is no housing? I'm not talking about a specific program today, more about the system and what the system looks like and how it works together and how it doesn't. For those of you who don't know, Launch Housing is a homelessness and community housing provider in Melbourne. So we operate from assertive outreach, entry points, crisis accommodation through to supporting people in long-term housing. And unfortunately, a number of our programs have a starting point where we know there will be no housing outcome for the majority of our participants. So we have to think about what does that mean for both our staff and for our clients in terms of what success looks like. How can you go home at the end of the day feeling that you've achieved something as a worker or as a client, that somebody cares and you've been able to make a difference, or you have a slight change in your circumstances or your sense of well-being. So the current system in Victoria comes from a good place. The intentions that we have are solid and probably shared by many people in this room. So it's a consumer-focused or a client-focused and strengths-based approach. There's equity of access to the resources of the homelessness service system. The problem isn't the equity of access, the problem is the availability of resources. Housing, services, support systems, etc. We can provide access to a certain number of people, but that's not everyone. Support for skilled workers with training, supervision, efficient tools, they're all in the principles. And we have a really good and solid system of collaboration and partnerships between agencies, both not-for-profit, community-based and government agencies. And that doesn't just include, the Department of Families, Fairness and Housing in Victoria includes homelessness services, but it also includes family violence, child protection, and a range of other support services that are quite important. And we also all work fairly closely with the Department of Health. And there also is an underlying principle that all reasonable care will be taken to address the risks that are faced by each person who presents to us experiencing homelessness. We can't solve them, but we listen, we hear, and wherever we can, we help. And what that means is maximising the use of our available homelessness resources, which can often be an incredibly robust discussion, both within the organisations and across the entire sector. And I'm sure many of you have been part of those conversations in your own work. So that system came in 2008, which I have to admit was before I was in the homelessness system service. But since then, in Victoria, social housing is now at 2.2% of all housing. So that makes it incredibly difficult when there's a number of people we're working with who are not private rental ready and who may never be. The social housing waitlist is around 60,000 people. When you're getting to numbers like that, or 60,000 households I should say actually, when you're getting to numbers like that, it can start to feel overwhelming. And some of my teams look after the prioritisation lists for their region, which is looking at who's waiting for support, who's waiting for housing, and who might be eligible for the various support systems, and then maintaining that waiting list. And so making sure that people feel motivated to come to work, that they can see the success that they achieve as a result for the individuals or for the one, the family that they've been working with for 4 weeks is really, really important, because otherwise you become overwhelmed by these numbers. There's also a really heavy reliance on private hotels and motels or an emergency response. We do have 423 funded crisis beds, so we look at those as beds that have support, that have on-site staffing, usually 24 hours. At launch we run 4 of those, so 2 that are for singles and couples, 1 that is family specific, and 1 that is a women's crisis accommodation. But we have constant wait lists, and so therefore everyone else that comes through is in emergency accommodation, so hotels, motels. Used to be a lot more rooming houses. There's a lot less of those, so we are actually, for better or worse, depending on what they were and where they were. So we rely very heavily on private operators, effectively, in the motels and hotel space, which requires a very different response and relationship management for teams as well, because you're used to working with people who understand where you're coming from and who know who your clients are, and all of a sudden you're working in a very different space. And so that takes skill and training as well. We have a system in Victoria called LASNs, which are local area service networks. So they're regionally based, where services come together to talk about the key issues that they're facing in the areas, service improvements that could be had, different providers that may or may not have new programs underway, or if a motel's closing or it shouldn't be used anymore. All those types of conversations happen in these forums. And the LASNs started running about 2017, asking consumers across all the services how they felt about the system. And this is just a snapshot of what that first entrance into the system felt like for people, and I'm sure it's not going to be surprising to many people here. But the question was having a roof over a person's head better than nothing? And it wasn't always the case. If it was unsafe, if it was demoralising, often led to an increasing sense of worthlessness and disconnection, particularly for families. So families are very, very hard to find suitable emergency accommodation that's safe. And there was an overwhelming view that the accommodation was a reflection of how the community viewed them. And I think that sense of stigma and empathy, it's really important for us to consider when we're doing our work and when we're looking at what happens on the ground. And when we're looking at the motels that we use, or the hotels, or the rooming houses, or the crisis facilities that we run, we have to be thinking about what does that mean. Everybody deserves a sense of dignity, and everybody's a person with their own life story, and nobody chose to enter the homelessness system or to become homeless. So we have to reflect that in the way that we provide services, even if we can't get a housing outcome. So what we know, the experience of homelessness is devastating. We all know that. Emergency accommodation is generally inappropriate and harmful. I want to clarify that though, by that's emergency accommodation that is not properly designed, planned or funded. So this is the adjunct to the system, what we're using because there's nothing else. That, I can feel my mic falling off, so sorry everyone. That is the emergency accommodation that we're talking about there, and it's quite different to purpose-built crisis sites. Also that harm has many dimensions, including physical and psychological harm to people and their children, but also psychological and sometimes physical harm to workers. And I'm not sure what it's like in other states, but in Victoria at the moment, that harm to workers has been increasing because the outcomes that we're able to achieve are less. And so therefore, the frustrations that people are feeling are coming back on the frontline staff. And that's, you know, while those frustrations are really understandable, it's not a position that we ever want people to be in when they're turning up day after day to do a job that is inherently difficult. But everyone who works in this sector is here for a reason and they're here to make a difference. And so what we've been doing is we've been working together in Victoria to look at it. What does that mean for our entry point system? What does it mean for our assertive outreach? How can our Housing First programs come together to think about better supporting people in a way that their frustration is lessened, won't be gone, but lessened, and that they don't feel like the system is actively working against them. So one of the things we really focus on improving is consumer or client experience of the homelessness service system. So how can we get fast access to affordable housing? And if we can't, fast access to safe, affordable, supported and self-contained shelter while they wait. So then it becomes, what can we do? It's going to really know. How can services in the context of a housing crisis and a resource-constrained environment meaningfully support people experiencing homelessness? We started looking at this through our assertive outreach programs because the people that we work with in assertive outreach tend to be the most complex. Often they've experienced homelessness for over 10 years. So the chance of getting a housing outcome is significantly lower because they usually need a supported housing outcome, and there aren't very many of those. So our staff start working with people on the ground, looking at what their other goals might be. Can we connect you to a health service? Is it mental health support? Is it where you can get food every day? Looking at sleep sites, we don't move, our assertive outreach teams do not have a move-on policy. We work with people where they are at the places that they stay and feel safe. But part of that is the advanced to zero approach, and looking at that, knowing people by name is really important to understand what it is that they need and what you can help them with beyond finding housing or a crisis bed. So people have really long established relationships. You can see it when there's an incident on the street, when there may be a death of a client. Our people feel really strongly about that because they know everyone by name in the areas that they work. And we celebrate the small achievements. So we celebrate when someone has been able to reunite, and this could just be a phone conversation, with a family member that they've been wanting to have contact with. We celebrate when they engage with a service that we might have been trying to get them engaged with for 3 years. We definitely celebrate if we can get them a crisis bed. And then the transition into that crisis support is smooth. It's a warm handover, people don't have to restate their stories, and they're given a few days to settle into a house before we really come and talk to them from a case management perspective and think about those next stage goals. And we also don't promise things we can't deliver, because I think that's really important. If we are promising people that we're going to get a housing outcome and we know we can't, that's really difficult for the people we're working with and our workers. So we're very clear on what we can and can't deliver within the resources that we have. I've kind of jumped to what is the value of assertive outreach, because it is a really important part of that. And I know that's working with rough sleepers, which is a smaller, it's a very defined part of the broader homelessness population. But in this context, I think it can be the most difficult sometimes because you're constantly seeing somebody in an unsafe situation. And you know it intrinsically when people are going home at night, that the people they've been working with that day aren't. So that is why we're focused on rough sleepers in this context. And then how can homelessness workers, so the workers within our services, be supported to provide effective support in an environment where they have limited access to the resources required to address people's housing needs, and can sometimes feel like they have limited ability to advocate for what's required. So what we've been doing increasingly since COVID, it's almost been a bit of a harder come down because we did have the opportunity of briefly feeling like we were ending homelessness during COVID. We were able to, people were housed in hotels. We had a program that allowed us to find housing for people and support them for 2 years. And there was a lot of hope through our teams and our staff, and people really committed to housing first. And for various reasons, that hasn't been able to continue. And that come down for staff has been really, really difficult because you had a period where you had options and you could see the light at the end of the tunnel. And now not just has that gone, but the actual inflow is much higher. The rental increases are affecting people a lot more. We're seeing more working families and working singles. And so how do we help people to get to that next point where we know a lot of that is partnerships and collaboration? The service coordination meetings that we have within our regions are essential because it helps remind people of the other options that you can have to help support clients in different goals. We've developed program logics for all of our program areas now. And while that might sound overly academic, and I have to say when we first started bringing it in, there was a little bit of resistance. Now people appreciate it because it can demonstrate the other outcomes that you can achieve that are not housing related. So you can always track your work to something that makes a difference, even if it's not housing. And that is really important for the stand up, get up in the morning and come into work type of approach, to be able to see. And we track it, we monitor it. Every year we publish an impact report that doesn't just look at housing outcomes. And every quarter we talk to the teams about what they've achieved, what impacts we've been able to make for individuals, for particular clients, where we've had, we showcase where there's been amazing collaboration across the organisation, where different programs have worked together to get an outcome that really had looked incredibly difficult at the outset. And we just talk about the way that we can make things happen. Like one of our biggest, the biggest achievements we have and we celebrate is getting children living in crisis back into the school system. They're still living in crisis. We haven't been able to solve that problem. What we have been able to do is reconnect them back into education, reconnect them back into a community that cares, make sure the parents also feel connected into that community, and through that, in the longer term, help break that cycle of disadvantage, because we're making sure that we're protecting children's futures by ensuring that it doesn't matter where they live, they can stay part of the education system, even if it's only for 6 weeks. And then we do a warm transition from the school to the school, wherever they go next, which might be transitional housing for 2 years. In some cases, we're lucky we can get people permanent housing. That's actually a philanthropically funded program that's been running about, I think it's about 8 years now. But it's one of those programs that everyone in the organisation knows that they can refer into, and that we have a chance to at least help someone, and we have a chance to help the younger generation. So they're the types of things that we do to make sure that our teams know that they are making a difference on the way through, that our clients feel like they're being supported, you know, that families understand they may not get a long-term house, but always appreciate the fact that we've been able to help facilitate, get the children back into school. Same if we're able to help people get into the health system, get contact with one of our nurses to deal with, you know, it could be a wound, it could be helping manage diabetes, any of those types of things which allow us to, and our teams, to feel like they've made a difference. We were talking the other day about the fact that there's been a lot of pneumonia in Victoria recently. It's been really cold, and it's been affecting people in, you know, in the workplaces. And we've been talking about how hard it is to manage pneumonia if you're on the street, because it's really, really, or even in, you know, quite inadequate crisis accommodation, because it's very hard to access those services, to get the appointments you need, to get the antibiotics you need, then to remember to take them, especially if it's got to be taken with food. Like, there's a whole run of things that you have to be able to do to manage what most of us would just see as a minor interruption to your life. So being able to help people into those, connect with nurses. Nurse practitioners play a huge role when we can't access GPs. Connecting with pharmacies where they feel comfortable. Help make sure that the antibiotics are being paid for. And those relationships that our workers have, they check in. Like, how are you going? Do you need any more? You feeling better? Do we need to go see somebody else? Those sorts of things help build trust and help build a belief in that you know what it is that you're doing. So I'm going to just go past that one. I've kind of jumped to the end of that. But I guess that's kind of where I wanted to say, because I agree with everything that has been said before about how we can work different ways that we can approach clients, work in a coordinated way in communities, but also how we can best support staff to identify and see where we are making a difference, even if it's not the original reason why you joined a homelessness organisation, which is to help people find housing. There's still benefits that are happening along the way. And it does work. Our turnover rate since we've brought this in, so staff retention, has dropped by 7%. We've actually, far more staff are staying than there were pre-COVID. And in part, it's due to this being able to understand that you are making a difference in what could otherwise feel like a very hopeless situation. So I think hopefully that is enough.
Thank you, Laura. Wow. Thank you very much to our three wonderful presenters, Laura, Tony and Tameka. Now a chance for our audience to ask some questions. If you could put your hands up, we've got a few runners around the audience. There we go, I've got one woman in the middle of the first row to kick us off.
I am a freelancer. I call myself a freelancer because I am a lived experience speaker.
Thank you, Helen.
Now, I've heard a lot of things that you can do, but what I haven't heard is, what actions are you doing to address stigma? What actions are people doing to address accountability? And the reason why I say this is there are a lot of organisations, support workers within the NDIS everywhere, where they're not doing the job that they're supposed to be doing. There are numerous cases where people are awarded a certain amount of money and what actually they're receiving isn't what they're getting. There's people that are on very low incomes that are trying to sell their furniture to pay for electricity. Why aren't the people on like youth allowance and job search allowance, why aren't we looking at ways that that rent covers general living expenses? And what are we doing to engage lived and living experience as part of this process? And bringing all those cohorts together to find solutions, because we keep talking about the same things, and it's the same results. What are we going to do differently?
Thank you, Helen. Well, there's a few questions wrapped up in that for the panel. So let's start with the stigma question that Helen raised. If anyone's got any thoughts on how your teams, you know, support breaking down stigma.
That's okay. I feel like I just spoke, but I can talk to that. It's that has actually been a really big focus of the work that we do. We started a movement in Melbourne called Melbourne Zero, where the entire purpose is working with organisations and people who are not traditional allies of the homelessness system, who may or may not be engaged with the homelessness system, to get people to understand that homelessness is not a choice and that it needs more than just the system and the not-for-profits working in it to make a difference, to build the housing, to invest in social and affordable housing, to not argue against having, you know, social housing targets in new developments, but instead to support them, to not argue against having, you know, new developments in their own backyard as well. And engaging that really broad group has been important. We've got about 8,000 people who are outside the homelessness system and 40 organisations who've joined up to that. And I think it's a slow process, but we've been doing some surveys around the broader community, checking in on how people feel, and the shift, there has been a significant shift in that people no longer see homelessness as a choice, that people understand that it can happen to anybody and that it's not something someone chooses. But it's hard to do.
Yeah, thank you.
I've seen that shift too. I think there definitely people do not see homelessness as an issue of choice. In one of the local government areas we work, where we're just commencing assertive outreach, the Shire of Byron Bay has probably the highest rate of people who are sleeping rough of any local government area in the country. Certainly more than the City of Sydney, and this year it was about 370, I think we'll count, a population of about 30,000. And it used to be said that the people that were sleeping rough in Byron were people who just wanted to get up early to get the dawn glass off and go surfing. That's not the belief anymore. I think there's a lot of awareness, particularly of the needs of women, you know, who've been, for example, living in their cars so their children can stay at school. So I think that's important. But the point of accountability is a very, very important one. I think it's something that we, as a homelessness service sector, need to get better at, reporting how many people we worked with, where the money went. So I'm really open to that. And we're also trying to kick off a Northern Zero project. And one of the things we'll be arguing for is that we can be open. This is how much funding we get, and this is what we, and you know, this is the number of people we worked with. But more important than the number of people you work with is actually some of the data that we were looking at earlier that's used in the US around how many people are housed, how long do people remain housed for, and I don't think in Australia we're very good at that yet. I think we need to really strengthen our data systems. The final one on lived experience, and sorry for the long answer, when the Tweed Assertive Outreach Project was being established, everyone got invited to sit around a table and talk about the problem, and I can see you're nodding knowingly there. And eventually one of the people, I'm glad it's one of my colleagues, basically said, look, I feel we're all sitting around here talking about this and there's no one in the room who actually has lived experience. And the representative of the funder, someone who doesn't work for them anymore, so I'm not in any way criticising whichever department now funds us, said, oh, well, look, we thought of that, but then we thought, no, it'd be too intimidating for people with lived experience. Now, there is no way that any of the current funders would actually say that. At the time, we were able to say, well, actually, we've got someone who, you know, slept rough for 40 years, who's now a lecturer at the local university with his PhD. So how about you ask him? So I think there is movement. but we're in the early stages, and I think it will move a long way. I think people like me, you know, we won't have the validity or the authority to talk in 20 years' time, if I'm really honest about it, and that's a good thing.
Mm. Yeah, just on stigma, I think the national housing crisis has really thrown homelessness, you know, out into, I guess, the sphere. Once upon a time, I feel like it was something that we just knew in our homelessness organisations, but now I think it's something that's on everyone's radar. So that's definitely, it's not positive, obviously, but in terms of stigma, that's one thing. And I think it's one conversation at a time, whether it's with community groups, schools, friends, family. I know that's something that we do through Hutt Street Centre, is we're constantly engaging with our community, our donors, our supporters, to do the best that we can to present the reality through our participants. When you mentioned lived experience, I think it's a conversation we're having all the time to do better. I know at Hutt Street, through our Wellbeing Centre, we have our community barbecue meetings once a month so that we can make sure that we're getting direct feedback into how our services run, because they're not for us, they're for our participants and our people that need our services.
Thanks, Tameka. And for Melbourne City Mission, you know, around stigma for young people experiencing homelessness, we do, every time we talk, we do look to try and bring lived experience in and have a young person that's actually been through that come and talk. And that really does help because rather than just data, the community can hear stories. And if you can hear stories and understand a young person's experience, well, that kind of removes a potential assumption you've got of why they're there. I also think for stigma, we've done a lot of work around how we advertise and how we fundraise, and having, you know, a really positive representation. I was so proud of our Sleep at the G this year, and the representation of young people throughout the billboards in Melbourne was just like, it's really empowering, really diverse group of young people, and really moved away from the stereotypes, you know, of fundraising. And that's, you know, a small part of shifting perception as well. In relation to income support, Helen, for youth allowance, we've uncovered this diabolical issue where young people on youth allowance don't trigger Commonwealth rent assistance, and the social housing sector relies on Commonwealth rent assistance to add to an already low income to pay for the housing, tenancy and maintenance services. So as a result, young people aren't housed in social housing. That's the financial barrier. And so we're doing masses of advocacy around that in terms of explaining to the state and the federal government something that I think they didn't realise, because they're two different systems and the dots hadn't been joined, and really advocating for that to be addressed either through the youth allowance, ideally that would be wonderful, through the CRA or through some other sort of rental subsidy. Now, would someone else like to ask a question? Oh, over here, we've got to my left. Thank you. One of the runners is popping up.
Travis Gilbert from ACT Shelter. Thanks for those presentations. They were really helpful for us, and I'm pleased that Victoria's found ways to reduce the stress and the burden that staff are feeling, because we are in exactly the opposite place in the ACT, and I think it would be dishonest of me not to say that we are seeing some of the highest levels of burnout that I've seen in my 2 decades in and around this sector. And so any advice anybody has to address that in the ACT, because we just can't get the housing outcomes, and as one of you said, that's why we're in the sector that we're in, and it just doesn't happen. And so we've got an election in October. We're trying to put housing on the agenda. If we don't start to see improvements to those rates of income support, I can't see how young people or anybody else in the ACT is going to make it, because I found 7 properties last Saturday that were lower than the maximum rate of the job seeker payment. And I noticed there's probably no federal politicians coming to this conference. If there are, I really think they need to understand that those rates of income support are critical. And we have been calling to raise the rate since Kevin Rudd 1.0, and we're still really waiting. We've had a couple of small increases, but I just want any advice over the next couple of days to lift the morale of our sector in the ACT, because we're losing really good people, and it's pretty heartbreaking.
I know this was one of
I was a little bit overly optimistic. We have still losing a lot of people.
Can I just interrupt for a minute? I'm actually from the ACT, and I'm one of the people that have been brought here because I've experienced homelessness, and I can actually agree 100% with what he has said. And I went through it myself 2.5 years ago, where I had a caseworker, and a week later I had a different caseworker, a week later I had a different caseworker, and at the time I was actually experiencing a loss of my business, of everything that I had. I lost my house, I lost everything overnight, and he actually, they actually helped support me, and the ACT is really, really struggling. And I'm part of the ACT government's Housing 10 Consultancy Committee, and that's one of the things that comes up every time we have a meeting. Every month it's brought up about how the workers are not being supported.
Yeah.
Sorry.
Thank you. I know this is a question as a panel we really wanted to talk a little bit more, so who would like to kick off about how you keep workers supported?
I mean, I can start a little bit around the hope and support, and I know I touched on it a little bit in the presentation. We're really fortunate that we've got this body of research, but I will say that by no means don't, again, like we were just saying, we present this really wonderful picture. It's still hard. And I think we all have days where we feel like we're failing. I know I feel like I'm failing and I'm letting my team down, I'm letting our participants down, but I think in terms of hope for the people that we're supporting, that relentless case management is really key, that continually showing up. And as tough as it is to be like, hey, I'm here again, no news, it lets that person know they're not walking this journey alone.
And Tameka, what about support for the workforce?
Yes,
I mean, you touched on that quite thoroughly in your presentation. What do you think is the key thing to kind of reducing retention, or increasing retention, reducing burnout of your workers, to Trevor's point?
It's absolutely that workplace culture. We've done a lot around wellbeing initiatives, whether it's different activities that we do as a team. It's health initiatives. We celebrate different the days throughout the year where we can come together as a team, share a bite to eat. But that culture was absolutely the standout that we've found, and as I said in my talk, that it is continuously talked about. When we have tough days, it's having a really supportive group of people around you that are sharing similar experiences. It doesn't make it go away or make it better, but it's I'm not alone. We can brainstorm, we can try to problem solve. We can work together, and we can have a laugh, we can have a joke, go for a coffee. That was absolutely the standout.
Yeah. Tony or Laura, do you have anything to add about the workforce and reducing burnout?
Yeah, I might clarify. So the situation is pretty dire in Victoria, to the point that our peak body actually did a workforce survey to understand quite how many people were leaving the sector or thinking about leaving the sector in the next 2 years. And it's a lot. I can't remember the stats off the top of my head, but it's very, very high. It's the WIDI report, which I can't remember what WIDI stands for, but if anyone's interested in it, we just saw it happening earlier. So we've been working on some of those, what's the other version of success? What are the things that mean you go home feeling better? We also brought on an organisational psychologist, like an industrial psychologist, who works with us a few days a week to work on that more crisis, incident debriefing, more proactive wellbeing support. So not like, we were doing wellbeing days where people would go out for lunch and things like that, but they weren't actually making much of a difference. Things have shifted a lot. We had to make savings in other areas to make that work, but it has been a highly effective and efficient way of helping build that. I don't like using the word resilience, but it's kind of in that context.
Thank you.
I think, building on what has already been said, I do think A lot of it sits with the workers we have. Like I have to say, we just have some amazing people who, will keep wanting to advocate around the system, keep asking me to advocate, keep filling me up with stories of success as well as things that haven't gone so well. But I think the characteristics of the workers that we're lucky enough to employ in our sector, that's a significant part of that, and then how we add to that and try and support it. The culture thing's really important. So, for example, Karen over there has done a lot on the culture in the office where she works around supporting staff and building morale. Ultimately, success is the best way to build culture, and I think being able to identify and celebrate when you do get success, because it can be rare, is a key part of it, and understanding that success isn't just housing. You need to look at where things have improved elsewhere, which also I think is key for the people we're working for, around helping them understand that they mightn't be housed, but actually look at these improvements elsewhere.
Thank you, Tony. Do we have another question?
We have a question at the very back.
At the very back, wonderful.
Good afternoon. Kelly Daly, Rockhampton Homelessness and Housing Programs Manager with St Vincent de Paul. I'm hoping that the panel could share their thoughts on the proposal of moving away from IHR and motelling and pushing for significant commitment and investments from the government, local councils to create safe, rough sleeping precincts within community. So safe spaces for rough sleepers where we can have services on site, where they're not moved on, where they have a space that is theirs while we're in this housing crisis.
Thank you, Kelly. This comes to that notion of what can we do for temporary.
Yeah. Look, years and years ago in Lismore Council, so that's one of the local government areas where we work, had the idea of doing exactly that. It's probably a good thing they didn't, because they had 2 major floods through there since. That issue highlights the dilemma we all face. Do we maintain a better quality of life, focusing on people's quality of life while they're unsheltered, as opposed to focusing on housing? And I think it's important that we maintain a high, that we keep our vision high, that we actually want people to be sheltered, we want them to be sheltered well, and that we want people to be able to stay in housing. And I'm personally very influenced by the work of the Canadian writer Ian de Jong, who has written a great book, the book on ending homelessness. And he warns us as a sector against the concept of therapeutic incarceration, where you essentially create so many services to support people when they're unhoused that it becomes very hard for them to leave that and move into housing. And we've seen examples of that in the emergency response in the Northern Rivers, for example, where people were accommodated in these temporary housing villages at no cost. And we've had staff who've actually had housing offers of social housing, and people have said, no, I can't imagine being able to pay rent. And so I think it's a tricky one, but we should be aiming for something that supports people's human rights and dignity to live as members of the community. And that should be our focus.
Can I suggest, Kelly, there's a session on, I think it's tomorrow, it's called Act Local. I noticed it's got a lot of councils on it, including the City of Melbourne. And, led by a strong Lord Mayor over 2 terms, they've really focused on rough sleeping and homelessness, and they're just about to open a 50-bed, 12-month supported accommodation using one of the council buildings in the heart of Melbourne. I think it really is a testament to council will, and it's a great addition to the City of Melbourne. So if you get a chance and you're really interested in councils and their role, I really encourage attending that session. Anyone else?
Yeah, and look, the other thing we've seen, we've actually sat down and plugged the numbers into a spreadsheet and worked out that you can actually provide good quality, professionally supported accommodation for people for less than, certainly the same as what some of the current profiteering private motel operators in the areas that we work do. And at least in New South Wales, and we're not the only people to say that, the state government has indicated in the last budget that they're going to actually pilot some of those models to find another way. It's not perfect, it's not housing first, but it certainly is a step towards housing people rather than enabling owners of motels to buy Porsches and Teslas for their children, which is what Jodie has certainly told me certain motel owners in Tweed have done.
Tameka or Laura, did you want to add to some information for Kelly?
I think just echoing Tony's thoughts that, I think it would be great for us to strive towards solutions rather than the band-aids, acknowledging that at the moment, unfortunately, that's the reality that we're in. In Adelaide or in South Australia, we do have code red and blue responses in instances of extreme weather responses, and we do get a bit of mixed feedback in terms of the people coming to the shelter to stay overnight about if it's something that they want to access or not. So some people are really grateful and appreciative for shelter and there's supports involved, and other people find it quite a lot because it's a lot of people all in one space, and we've just had mixed feedback. So again, I think it's that we really need to be pushing for the longer term solutions.
Yeah, part of it too is supporting staff in their ideas and advocacy as they're working with people. We have had recently in one area, our outreach workers, just as a small example, identified that about a third of the rough sleepers, so not in our main CBD, were actually people who had previously been living in share houses, working hospitality jobs and a bit of the gig economy, but completely outside the homelessness system, who during COVID lost their jobs, lost their housing. And so identified that if we actually were able to support them into some form of accommodation for 3 months, which is far beyond what we would normally do in emergency accommodation, most of the people we were supporting there actually were able to regain the lives that they'd had previously. The gig economy's kind of started back up again. People were able to get hospitality jobs again. A lot of people were newly arrived immigrants or didn't have any other access to income beside what they can earn themselves. And so they actually now, we're seeing, shifting outside the homelessness system. And that wouldn't have come about from anything that we were doing. It was, at a higher advocacy level. That was on the ground, staff saying, you know what, I think actually for this group of people, we can make a difference if we do something differently. And so I think there's something in that trust and saying, go ahead, do it. Don't, it might not work, might not have
Ideally
worked.
a bit of flexibility,
But at least
the funding
try,
models
right?
to allow that.
Yeah, it's the flexibility that's really important because each community is a little bit different. So what works for one might not work for another. Safe sleep sites in one local government area may not be appropriate in a different one, or it's hard to kind of do an overall
Lovely.
response.
Well, look, I'm going to thank our presenters, Tony, Tameka and Laura. And thank you all for attending this session. I'm going to just offer on behalf of our presenters over lunch, any of us might be happy to have a bit of a chat. We haven't had as much Q&A as we would like. It's gone so quickly. At 1:30, Plenary 2, Closing the Gap, Priorities and Reforms for Housing and Homelessness is back here in Hall C. So enjoy lunch and networking and see you back here at 1:30.